So, what is ECT? ECT stands for electroconvulsive therapy, and it's used for people with major depression, bipolar, and schizophrenia, the catatonic schizophrenia. Basically, what happens is you get a treatment every 3 days for a week, and then you go and you get 2 days a week, and then you do 1 day a week, and then you do once every 2 weeks, and then you do once a month, and then from there on, I think you just do once a month as maintenance. Sorry, my dogs are fighting in the background. Basically, you go in and they hook you up to an IV, and they give you a sedative and a muscle relaxer, and then they give you some oxygen through your nose, and then they wheel you back to the room where they do the ECT, and they'll clean your forehead with a little wipe with like alcohol and a gauze wipe, and they'll have these little monitor things that they stick here, and then you have monitors here and here, and then here and here, and that's just to monitor your heart rate and your heartbeat, I guess. Basically, they give you a shock for either bilateral ECT, which shocks you from here and here, or there's unilateral ECT, which shocks you from the middle and the side, and the shock just goes through your right side of your brain instead of both sides of your brain. I've had bilateral ECT before, but I have not had unilateral ECT. So, basically, once you're in the room and you're hooked up to the machines and everything is good, they'll give you something to make you go to sleep, which, in my case, it did not sting. It didn't hurt. But some people say that it stings a little bit. It just depends on the type of medicine they use to make you go to sleep. And once you're asleep, they'll give you the shock and you'll have a seizure. And they check and see how long your seizure is and make sure it was long enough. And they help you breathe while you're asleep, because the medicine, the muscle relaxer, is really strong, and it kind of paralyzes all your muscles, so you can't really see yourself having a seizure. You just have a seizure and you barely shake, like you go like this. And that's it. You don't completely flop around and flail around because of the muscle relaxer. But then a few minutes later, you'll wake up and they'll check and make sure you're doing okay. Sometimes they'll give you Zofran, which is a nausea medicine, because sometimes it makes you nauseous. And for me personally, when I woke up, I was really dizzy and really sleepy, groggy, kind of. Everything was kind of fuzzy, but there was this weight that was lifted off of my shoulders, like someone just took 10 pounds of unhappiness out of my head. And you feel good afterwards. Sometimes you'll have a headache, and sometimes you won't, but be really slow to stand up. If you stand up too quick, you will fall down. Make sure you have someone to drive you home. You don't want to be driving after ECT. And just try to relax, take it easy, eat something. Eating always helps. Eat some chocolate. But yeah, and as for me, I'm going to be going to get ECT again shortly. I had it a year ago, but I never did any follow-up treatments, so the effects of it wore off. But me and my doctor are talking about doing another round of ECT right now, and he thinks it's a good idea. I think it's a good idea. I'm still nervous about it, but I think anyone would be nervous about it. Just pray for me. Alright guys, see you later. Bye.